My patient journey began back when I was 26 years old, and I developed endometriosis. And I went through a few years of treatments, surgeries, medications, tried a lot of different things, ended up having to have a full hysterectomy, and that was resolved, and I thought, I can conquer anything, I beat this, and I'm going to be doing great. And at the age of 29, I developed a neuroautoimmune disease called reflex sympathetic dystrophy, which is a rare disease. Doctors didn't know what they were looking at. It took 43 doctors and 3 years to get a proper diagnosis this time. And I did all the wrong treatments. I was overtreated, undertreated, mistreated. And after 3 years, finally a doctor looked at all of my records from all the other doctors, which at that point was three 3-inch binders, and was able to give me a diagnosis and give me the proper testing to get an official diagnosis. And it still took another 4 years to get the right treatment, and that's why I became a patient advocate and someone who wanted to share their voice in the chronic pain community so that other people don't have to go through what I went through. Some of the biggest challenges in my digital health experience were getting access to my records, making sure that my records were accurate and getting those changed when they weren't accurate, getting the proper diagnosis. One of the worst problems that I went through was receiving a diagnosis from a radiologist instead of from a doctor or oncologist, and had no idea of where to go or what to do because the wrong doctor told me the information through an email. And although I really like getting text messages and reminders about appointments and maybe don't eat after midnight before surgery tomorrow or that type of message, getting a message that said that I had cancer was one of the worst ways to find out that I could think of, and that was probably the biggest breakdown in tech that I went through. But I also went through times where IVs failed or different machines that I went through were not working properly, and that was a challenge. And what do you do in that moment? Do you leave the hospital or leave the doctor's office, or do you stay and try to work it out? And having to go through and face those decisions when you're trying to bring technology into what you're going through as the patient experience can be quite a challenging thing to do. The advice that I would have for stakeholders in the chronic patient communities is to include the patient's voice in the projects that you're doing. If you're doing research, have them help create the research projects. Ask them what it would take for them to be able to leave their homes and come into your facilities for that research project. Or if you're creating an app for a patient to use, what do you see as the end user, as the consumer, the patient, the positives and negatives, and how easy or hard is it for them to use. A lot of patients are not tech savvy, and for those patients, they need to have their voices heard and be understood, but they don't always get the technology. So make sure that if they're that type of patient that needs a little bit more, that you take the time to educate them, but also listen to their voice at the same time. What keeps me passionate in the work that I do is being positive, hopeful, and hoping that one day there'll be a cure for what I'm living with. And I want people to know that the health system can be challenging, and that if you take it moment by moment, you can cheer yourself to and through any of the challenges and obstacles that come up, and know that as long as you're alive, you can keep it on, living your life and getting through the healthcare system. But it takes you to be an active participant on whatever level you're coming to the table at, whether you're the patient, the provider, the research scientist, the data collector, whatever your job is. It's an important job in the overall process and outcomes for pain patients.